speaker is Dr. Peter Selvaratnam. Now, I know he doesn't need any introduction, but I'm going to have the pleasure of introducing him anyway. Peter is a rare breed. When I did my postgrad, we all called him Mr. Magic Hands. And you know, you've had people work on you who just have that absolute innate ability. But this man also has all of the stuff going on behind that as well. As I said, a rare breed. Peter is a specialist musculoskeletal physiotherapist, an associate clinical professor at the University of Melbourne, and an adjunct senior lecturer at the Faculty of Medicine at Monash University. Now, if I just stop there, that's impressive, but I won't. He's the principal at Melbourne Spinal and Sports Physiotherapy Clinic, the Headache Centre of Victoria, and he runs educational programs for Back to Life in conjunction with the University of Melbourne. Peter has a PhD in functional anatomy of the cervical spine and nervous system. Wow. He's written many articles in international journals and recently published a book with Ken Neary and Maria Zuluaga, and you have some information on that in your packs. This book has been very well reviewed by the medical and physiotherapy professions. To dry needling. Peter initially studied acupuncture in Sri Lanka, and he now teaches dry needling at the Victorian APA Level 1 course. Also at the University of Melbourne Masters Program, a Malaysian university, and also in voluntary medical missions to the Pacific. Please join me in welcoming Dr. Peter Selvaratnam.
Thank you, Sarah, for your kind words. And thank you and your committee and the effervescent Judy Orford for the hard work in organizing this sumptuous breakfast in the last 4 months. I will try to live up to the occasion. Thank you, each of you, for coming here on a cold, wet, wintry Melbourne morning. If you didn't come, I would be very cold and lonely. It is very apt that we are discussing about low back pain and sciatic pain at Caulfield Racecourse, where Black Caviar won in September last year, and recently, despite a sacroiliac joint injury, won at the Royal Ascot. Now, when a horse has a back injury, it's very often career-ending. But for many of us practitioners, an injured patient is career-facilitating. And we have a duty of care to get them to the best potential. And I know that we in Victoria and Australia do it very well, because I've gone to many countries and the standard of healthcare is very high, except our patients become more demanding. So I'm happy to present today a case study which deals with lumbar and sciatic conditions and how we use dry needling as an adjunct in the management of the patient. The patient happens to be here, so don't ask me any curly questions.